Good evening, friends. Today I am going to talk about the disease syphilis. Syphilis is a sexually transmitted infection that's treatable with medications. Without treatment, syphilis causes serious health problems. It can permanently damage your heart, brain, muscles, bones, and eyes. To reduce your risk of infection, always use a condom during sex. What is syphilis? Syphilis is a sexually transmitted infection that spreads when you have vaginal, anal, or oral sex with someone who has the infection. A bacteria causes it. Antibiotics medication treats syphilis. Untreated syphilis can lead to serious health problems including blindness and damage to your brain, heart, eyes, and nervous system. Stages of syphilis. There are four stages of syphilis. First is primary syphilis, second is secondary syphilis, third is latent syphilis, third is tertiary or late syphilis. Primary syphilis. The first stage happens 2 to 12 weeks after exposure to someone with syphilis. During this stage, a smooth, hard sore called chancre develops on your genitals or mouth. A chancre is small and usually painless, so you may not know even when it's there. The sore goes away on its own in a few weeks or months. However, this doesn't mean that you don't have syphilis anymore. If you don't receive medications, the infection moves to the second stage. You can pass syphilis through vaginal, anal, or oral sex during this stage. Secondary syphilis. About 1 to 6 months after the syphilis source goes away, a rough bumpy syphilis rash appears. The rash can cover your entire body, including your palms and soles of your feet. The rash doesn't usually itch. You may also have symptoms such as fever, fatigue, wart-like sores, muscle aches, weight loss, headaches, hair loss, swollen lymph nodes. You can pass syphilis infection during this stage, during vaginal, anal, or oral sex. These symptoms can come and go for months or years. Just because the syphilis rash is gone or you aren't having any of the above symptoms doesn't mean you are no longer have the infection. You still need treatment with medications. Without treatment, the infection will move on to the latent stage. Latent syphilis. If you don't receive treatment during the first two stages of the infection, it moves to the latent stage. In this stage, there are no outward signs or symptoms of syphilis. Some people experience mild flare-ups from time to time. At this stage, the infection can damage your heart, bones, nerves, and organs. This stage can last up to 20 years. It's rare to pass syphilis to a sex partner during the latent stage. Without treatment, the infection progresses to the late stage. Late tertiary syphilis. For many people, symptoms doesn't progress past the latent phase, either because the infection cures itself or because symptoms are too mild to notice. About 20% of the people progress to the late stage of syphilis, which causes a range of serious health problems. These problems occur slowly and include brain damage, dementia, and cognitive health problems, heart disease, movement disorders and muscle problems, nerve damage, seizures, vision problems including blindness. What is congenital syphilis? Congenital syphilis occurs when you have syphilis during pregnancy and pass the infection to the fetus. Syphilis causes severe health problems in babies and young children. Your pregnancy care provider should screen you for STIs at one of your first prenatal visits. It's important to receive treatment right away if you have syphilis. Who might get syphilis? Anyone who's sexually active can get syphilis, but your risk is higher if you have unprotected sex, especially if you have several sexual partners, or a man who has sex with men, have HIV, have had sex with someone who tested positive for syphilis, tested positive for another STI such as chlamydia, gonorrhea, or herpes. What does syphilis looks like? In the first stage of syphilis, a small smooth sore develops on your genitals, mouth or lips. It may resemble a pimple and be so small and harmless that you don't even notice. This sore goes away on its own in about 6 weeks. In the second stage of syphilis, a rough red or brown rash develops. It begins in one area but it eventually covers your entire body including the bottom of your feet and palms. You may have skin rashes and or sores in your mouth, vagina or anus. Where can you get syphilis? Syphilis affects your entire body. However, the first sign of syphilis is an ulcer-like sores. It develops where the bacteria come in contact with your skin during sex. The following areas are where you are most likely to find syphilis. So, cancer. In women, on your vulva, that is in your external genitals, in or around your vagina, around your anus or inside your rectum, in your lips or in your mouth. In men, on your penis or scrotum, under the foreskin of your penis, around your anus or inside of your rectum, on your lips or in your mouth. What causes syphilis? The bacteria Treponema pallidum causes syphilis. An infected person spreads the bacteria through vaginal, anal or oral sex. The bacteria can enter your body through the anus, vagina, penis, mouth, broken skin. The bacteria continues to spread throughout your body, which can eventually damage certain organs. How does syphilis spread? Syphilis is contagious, especially in the primary and secondary stages. When you have sores, ulcers, or a rash, syphilis typically spreads from person to person during sexual contact, even if there is no penetration or ejaculation. However, you can get it in any part of your body touches the sore or rash of someone with syphilis. If you have syphilis and have sex, you can affect your partner. If you are pregnant and have syphilis, you can pass it to the fetus. But you can't get syphilis by touching objects like toilet seats, utensils, or doorknobs. This is because the bacteria that causes syphilis can't survive on the objects. Can syphilis causes problems during pregnancy? Yes. If you have syphilis and don't get treatment, you can pass the syphilis to your child. Up to 40% of babies born to the people with untreated syphilis die from the infection. It's most common to spread the infection to the fetus during pregnancy. But it can also happen during pregnancy, delivery if your baby has direct contact with the syphilis sore on your vagina. If a baby is born with syphilis, it is called congenital syphilis. Syphilis during pregnancy can also cause miscarriage, premature birth, low birth weight, issues with the umbilical cord, stillbirth, death within the first 28 days of life. This only occurs if you don't receive treatment for syphilis. These potential complications are why attending your prenatal visits and getting tested for STIs is so important. Treatment before 26 weeks of pregnancy leads to the best outcomes. Complications. If you don't receive treatment and syphilis progresses to the last stage of infection, you are at the risk of life-threatening complications. Damage to your body gets worse. The longer you have syphilis, that's why it's so important to get treatment right away. Untreated syphilis can cause blindness and paralysis and lead to problems within your heart, brain, spinal cord, and other organs. How is syphilis diagnosed? Your healthcare provider will ask about your sexual history, including whether you have practiced safe sex. It's important to be honest during discussion. Your provider can help to assess your risk and recommend tests for other STIs. To test for syphilis, your provider will examine you and take a blood sample to look for signs of the infection. Your provider may remove some fluid or a small piece of skin from the syphilis sore and look at it under a microscope. If you want more information, please like, share and subscribe to my channel. Thank you.